Okay, so what we're looking at here is the pelvic girdle, which includes our right and left os coxa, or coxal bones, connected in the midline to the sacrum. Now the sacrum is made up of 5 or 6, it can be a little bit variable, but around 5 or 6 fused vertebrae. And hanging off the tip is usually between 3 and 4 fused smaller vertebrae making up the coccyx. So the joint where the coxal bones meet the sacrum is called the sacroiliac joint. Now specifically, this portion of the coxal bone is known as the ilium, and we'll go into more specifics on why that is in a minute. So anyway, the sacroiliac joint forms between the sacrum and the coxal bones, and you may hear that clinically referred to as the SI joint. Now, in an articulated pelvis like we see here, we also see some components anteriorly. On each coxal bone, we have an opening called an obturator foramen, and this is an important place where things come in and out, specifically like blood vessels, that kind of thing. Laterally on each os coxa, this is where our ball and socket joint forms between the os coxa and the femoral head. This is formed, it's kind of a complicated formation of 3 different bony components, but collectively it's known as the acetabulum. Acetabulum. Anteriorly, the 2 os coxa come together in a little fibrocartilage joint called the pubic symphysis, and this is on the anterior portion. So this is right in the pubic area. And we also have the pubic arch. So the pubic arch can be an indicator on whether a pelvis is male or female. If you have an obtuse to right angled pubic arch, we would call that a female. If it is an acute angle, it would be a male. So in this one, we're looking at a female pelvis. Now, the pelvic inlet is basically the opening into the pelvis from the inside. The pelvic outlet is the opening from the inside to the outside. So in a female, this would be much more open. In addition, females have a much less dramatic sacrum and coxal curvature, and that's to allow a baby out of the birth canal. So if we were to look at a male pelvis, for example, this one, which I'll move into view now, we see our acute angle. We see the pelvic inlet is much smaller. The pelvic outlet is also much smaller. And the angle of the sacrum and coccygeal curvature is much more dramatically inward curved, not conducive to passing a baby through that pathway.